Hello and welcome. My name is Dr. Ryan Seutter. I'm a cardiac electrophysiologist with Secours, and thank you for joining me. A cardiac electrophysiologist is my specialty, and there's different types of cardiologists that you may be aware of. I'm an electrician. We also have plumbers who take care of blockages and such inside the heart. And we have also pump specialists, congestive heart failure specialists, there's imaging. But within the specialty, again, I'm a cardiac electrophysiologist. I do many types of procedures, so all types of electrophysiology within Secours. Some of those include ablations. There's different types of arrhythmias that people can have. You may feel palpitations, you may feel your heart race, may feel your heart skip beats from time to time. Some of those are fairly benign conditions. It's not uncommon for even the most elite of athletes to have different types of skip beats and arrhythmias. Some types of arrhythmias can be very dangerous arrhythmias. There can be things like atrial fibrillation, not so dangerous, but can be at increased risk for stroke. There can be also ventricular tachycardia and fibrillation, which are rhythms that can increase your risk for sudden cardiac death. Some of these rhythms can be associated with underlying heart disease, if you have a weakened heart, congestive heart failure, valve disease, and such. One of my favorite procedures is actually an ablation that we use for atrial fibrillation. There's different types of ablations we can do for atrial fibrillation. Sometimes we can do things inside the heart. We call it percutaneous or minimally invasive. There's other types of ablations and things we can do on the outside of the heart. They tend to be a little more risky, a little more involved. But the way that I do my atrial fibrillation ablations is usually with a special type of balloon. It's called a cryoballoon. The way I do it is I take a special catheter wire through the groin. Within the groin, there's a big vein that goes all the way up to the heart. And I can access the entire heart and different structures inside the heart through that vein. I take a special balloon and it goes in as part of the heart we call the pulmonary vein. Once it enters into the pulmonary vein, it expands and it actually freezes, and for lack of a better term, it squashes the flame or the spark that triggers the atrial fibrillation. It's relatively new in the past 3-4 years, and it's been each year it gets better and better at the overall success rate and reduced risk. So from ablation standpoint, again, do all types of ablations in addition to atrial fibrillation, SVT, atrial tachycardia, ventricular tachycardia. Some of the other procedures that are very frequently done are placement of pacemakers and defibrillators. Within pacemakers, some of the newer technologies have allowed patients to have pacemakers that are MRI compatible. Previously, people would worry about microwaves, exposure to radiation, but pacemakers these days, we have the option to put MRI compatible, so whether or not you use a cell phone or you get an MRI or you go through the airport security, it's not going to damage the device. Within the technology of defibrillators, which are a special type of device to protect people from sudden cardiac death, if somebody has a dangerous rhythm that would potentially cause them to pass out and their heart starts fibrillating, this device would detect that rhythm and give the heart basically a shock back to life. Now, it's not fun getting a shock, but the alternative is worse. Some of the new technologies within defibrillators, we can put defibrillators not only deep inside the body, inside the heart, but we can also put them underneath the skin. Some of the other devices that we use and newer technologies are special types of loop recorders. We call them specifically subcutaneous loop recorders. Perhaps if somebody has episodes of passing out very infrequently, every once a year, once every other year, and we're worried about a rhythm as a cause, I can put a little device under the skin that the battery lasts up to about 3.5 years. Or if somebody has a stroke that we think may be due to a rhythm that's very infrequent, these devices can monitor the rhythm and make a diagnosis to help treat or create a treatment plan long-term for the patient. We also are offering, we call leadless pacemakers. So traditionally, the pacemakers, defibrillators have had a wire deep inside the heart or around the heart. But we have new types of leadless pacemakers that are small, not more than about 1 inch, and it can be placed through the vein up inside the heart, and it just sits right in the tip of the heart and can pace the heart that way. So people who have issues with veins that perhaps are blocked patients who have other conditions that increase their risk of infection and such. These little devices can be planted directly inside the heart and basically will take over the rhythm and pace the heart as needed. Those are kind of a summary of services and procedures and things that I do for on a regular basis. I work in Hampton Roads. Specifically, most of these procedures are performed at Maryview Medical Center. But I also work at DePaul and do some procedures at Mary Immaculate as well.
We have a question. What is the difference between pacemakers and defibrillators?
Yep, good question. So a pacemaker is strictly a device that paces the heart as necessary. If the heart goes too slow, it'll send an electrical impulse and bring that rhythm up to speed. A defibrillator is a device that gives a high shock or high voltage output all at once to basically convert the heart from usually a very fast, dangerous rhythm back to a normal rhythm, so it creates a reset. Now, almost all defibrillators these days do have pacemaker functions, except for some of the newer ones that I mentioned, but in usually, again, almost all defibrillators these days have pacemakers. Years ago, they were two separate devices. But so either somebody has a defibrillator with pacemaker functions built in, or they have just a pacemaker just for pacing the heart.
How do I know if I have a problem with my heart rhythm?
Another good question and a little bit difficult to answer sometimes. As I mentioned before, some of the symptoms of a heart rhythm problem could be very subtle, just skip beats, feeling your heart palpitation, feeling dizzy, lightheaded, having chest pain or shortness of breath. Usually any of those symptoms should be evaluated at least by your primary physician or by a cardiologist, because they could all be heart related. What determining whether or not any of those symptoms could be something more dangerous is a little bit more complex, and that's where we usually need to be seen, or you need to be seen by your family physician or by a cardiologist. We need to usually run some tests. Things that we can do are things like echocardiograms, looking at the heart function, looking at the heart valves, looking for blockages, because again, some of those symptoms can be very benign or things that are very common and nothing to worry about, perhaps drinking too much coffee one day. But some of them can lead to or be associated with more advanced heart disease and should be definitely checked out. Okay.
Are heart problems more common in women or men?
So the traditional thought is that men have heart attacks and women don't. But actually, women are just as susceptible to heart attacks and heart disease as men. Unfortunately, women have a little bit different symptoms than men commonly do. A man will usually have a heart attack and they'll have chest pain, the heart will be squeezing, those types of things. Women, unfortunately or fortunately, they present differently. They may have just some mild shortness of breath. They could even have palpitations. They may feel cold or hot and sweaty and things like that. So the bottom line is both men and women die similarly from heart disease, but unfortunately, society and the way that we look at people, sometimes we don't think women have heart disease, but they actually do, and they should be seen and evaluated just as aggressively as men should be.
Does family history factor into risk for heart disease?
Family history is a big risk factor, unfortunately, for heart disease. The younger you are of perhaps either a mother or father or even a sibling that had heart disease, unfortunately, the more likely you are to have heart disease as well. So if you have any symptoms like I mentioned, chest pain, shortness of breath, these types of palpitations, dizziness, passing out, you shouldn't ignore it, whether or not you have a family history. But if you do have a family history, I would even be more cautious in my approach.
What are some ways to prevent heart disease?
Preventing heart disease is difficult, but it can be done. Probably the most important thing with heart disease to know is that heart disease usually develops slowly over time, whether it be from bad eating habits, lack of exercise, smoking. So since heart disease develops over a slow period of time, it only makes sense that heart disease is treated and cured over a slow period of time. So things that you can do to reduce your risk of heart disease. If you're a smoker, please stop. If you're exposed to secondhand smoke, try to avoid that. Things like regular exercise, activity 3 times a week, getting your heart rate up, being conscientious of the food you're eating. There's no special magic diet, although you might see on the internet there's 100 diets that are the best. But there's really no special one. It's all about calories and enjoying everything in moderation. That's how you're going to prevent heart disease, by staying active, eating right, and avoiding things that can be triggers such as tobacco and smoking use.
Do you put in pacemakers, or is that a separate physician?
No, I'm the so again I'm the electrician of the heart. So if you need a pacemaker, you might see me someday. I might be putting it in, but I put in the pacemakers, the defibrillators, and do the ablations.
When should people start having heart health screenings?
Heart health screening can be a useful tool at just about any age. More and more people are having heart disease at a younger age, even in their teens and 20s. So being screened for things like high blood pressure, calcium, and cholesterol, there's not a magic age to start at, but even in your 20s is not an unrealistic plan to be checked out.
What is the Heart Health Challenge?
So the Heart Health Challenge is something offered through Secours. If you look on the website and search on there, it should come up. But it's composed of three major things. Number one is there's a questionnaire on there to get your heart healthy, and talks about some of the things that I mentioned, such as activity, diet, and exercise. It also involves a heart scan, which is a calcium score, which gives an idea of what is your overall risk of having heart disease. Could I have blockages and such? And it's basically a CT scan that's done, and can either put you into a low, intermediate, or high risk. And the third part of it is there's a referral, and there's a list of potential providers to make an appointment with to discuss some of the things that I've talked about today, if you feel like it's a concern. I think that's it. All right. Thank you for listening. And again, my name is Dr. Ryan Seutter, and my information is on the website. Thank you.